Welcome back, ladies and gentlemen. I'm here with Dr Maurice Brygel from the Melbourne Hernia Clinic. He's done over 9,000 hernia procedures and is very well known throughout the University of Queensland School of Medicine and Health Cert conferences, and also throughout the hernia community as well. He also has quite a large website and large resource available on his website. Is very well known in this space. I'd like to throw over to Dr Maurice Brygel at the moment just to tell us a little bit more about what he's been up to lately.
Okay, well, some of the things that we're doing recently is we attended, first of all, the European Hernia Society Congress in April 2011 in Ghent in Belgium, where surgeons from all around the world, particularly from Europe but also the United States and England, participated and exchanged ideas and presented papers on the latest techniques in inguinal hernia repair, either open or laparoscopic, and also incisional hernias. Now, incisional hernias have become a hot topic because of the introduction of laparoscopic surgery and the introduction of different types of mesh which make the surgery safer. Now, you may not know it, but incisional hernias are a very common type of hernia. Following any abdominal surgery, there's possibly a 20 to 30% chance of you getting a hernia in that cut. Even if the cut is just a small one, for example, for a laparoscopic cholecystectomy, the little cut can even get a hernia. So incisional hernia is a very common problem. Often people don't do much about it because the repair of them is fairly complicated, and the repair of them, until now, has been pretty poor, and the results pretty poor. In other words, if you've got a decent-sized incisional hernia, and you had your hernia repair carried out, there might be only a 20 to 30% or 70% success rate and a 30% failure rate. So it was a fairly daunting prospect to go back for this sort of surgery, particularly if you're overweight and got a lot of other medical problems. Well, at the conference, there was a lot of discussion about the best way to repair these hernias, either with the open, that's with a sort of cut, or laparoscopically, that's keyhole surgery. And the consensus was fairly divided. Well, at the Melbourne Hernia Clinic, we have Mr. Charles Lycombe. Now, Mr. Charles Lycombe has his own technique for repairing incisional hernias, and he's analysed the cases, and there's been a very high success rate. He uses the open technique, but he uses a few other modifications which have added a benefit to the results, and with particularly a low rate of wound infection. So he does what's called the open incisional hernia repair, and he uses a mesh, and he uses several layers. He incorporates the mesh deep to the muscle and sometimes even superficial to the muscle, but first of all attempting to close the abdominal lining, the peritoneum, so that the mesh does not stick to the bowel, which is one of the hazards of laparoscopic or open hernia repair. If you put a mesh in the abdominal wall next to the bowel can stick to it, and then you get adhesions and bowel obstruction. So that's not good. So the meshes that have been developed have got one side which absorbs and doesn't react with the bowel. And he's analysed 30 to 40 of his cases, and one case needed reoperation, and there was no evidence of any adhesions from these meshes. Together with the incisional hernia repair, patients are often obese and have a large fatty overhang layer, and these patients have multiple scars on their abdominal wall, and so that they like to have, as well as the incisional hernia repair, an abdominoplasty. Now, an abdominoplasty consists of removing that fatty layer all over and giving you a nice slim tummy. And we can see on our website photos and videos of this, and also on YouTube. Now, the other advantage of doing an abdominoplasty at the same time as the incisional hernia is because you have to mobilise the whole abdominal wall, you can see the incisional hernia very well. And as a result, there's a much more accurate repair, and Mr. Lycombe's results have been excellent.